Okay, so today we're just going to look specifically at the skull. So if we're looking at the skull itself, all by itself, it has 22 bones. 8 are considered cranial and 14 are considered facial bones. There's also 3 bones in your middle ear, the hammer, anvil, and stirrup. We won't talk about that on our test. We'll talk about that more when we get into hearing. So the cranium is the outside back top part of the skull. It encloses the brain, it protects the brain, attachment for muscles, and then it also contains your sinuses. So sinus infection, the sinuses in your skull help to make it lighter and easier for you to carry your head around on your body. It also helps with vocal resonance, so speaking and things like that. So your sinuses are located in your cranium. The bones that you're responsible for knowing. So frontal bone is going to be your forehead, and there will be a diagram that we'll get to. So front should be easy to remember. Front is basically your forehead, your frontal bone. Supraorbital foramen and frontal sinuses. So a foramen is a little opening, and it's usually for a nerve to go through. So right above the eye, there's a small opening for a nerve to go through, and then your frontal sinuses. So if you have that horrible headache that's like right in your forehead area, that's probably your frontal sinuses that are causing that. Parietal bones lie at the sides of the skull. So frontal is forehead, parietal is going to be up on the sides. There's 2 of them, just behind the frontal bone. And then they are connected by a suture, the sagittal suture. And then the coronal suture is where they're going to meet on the front. So 1, 2, 3, 4 things there that I would expect you to be able to label. So if I'm looking at a diagram, this large part is the frontal bone. This would be a parietal bone. This would be a parietal bone. There is the coronal suture. So the suture is where they attach. So coronal, think crown, it comes up and around. And then there's a sagittal suture that's going to run back in between your parietal bones. If I keep looking here, some important ones that you'll want to know. Squamous suture, we'll look at that. That's going to separate your parietal bone from your temporal bone. So temporal bone, you'll be responsible for knowing. Zygomatic bone, you'll be responsible for knowing. Zygomatic deals with cheeks. So your zygomatic bone is going to deal with cheeks. Maxilla is the top part of your jaw. Mandible is going to be the lower part of your jaw. And those are probably nasal bone. Some of these inner ones that are in the orbit of your eye, I don't know that I will have you label those. Sphenoid is right above the temporal bone. And then inside your eye orbit, there's a small lacrimal bone, and then the ethmoid bone that sits behind. So here are your sinuses, and I really probably kind of like this diagram a little bit better to see where they're actually at inside of your bones. So frontal sinus, I think of sinus headache right in the middle of your forehead. So those are your frontal sinuses. Ethmoidal air cells, they're smaller sinuses. They're little openings that are in the ethmoid bone. Sphenoidal sinus, fairly small. And then maxillary sinus is going to be inside of your maxilla. So the name of the sinus specifically goes with the name of the bone that it is found in. And by far the most common would be frontal. Occipital bone sits at the back of the skull and base, so it would be down towards the bottom. If I actually look at a skull, it's going to be this base bottom part down here. So it's the back. Things that you should know there: lambdoid suture, foramen magnum. That's a large opening where the spinal cord is going to come through and enter to reach the brain. So the foramen magnum, here's my occipital bone, right here, the base, the bottom. The foramen magnum is this opening on the bottom, and that's where your spinal cord goes through. So we talked about, you know, foramens being where nerves come through. The foramen magnum is a large opening for your spinal cord. Temporal bones, they're going to be where you think of like your temples along the side. Features there, we'll look at the suture. External acoustic medius, this is basically the opening for your ear. Mandibular fossa, probably won't have you label. Mastoid process, styloid process, zygomatic process. I will expect you to know where all of those are. So, if we keep going, sphenoid and ethmoid I won't look at as much because these are a little bit more further back. Sphenoid helps form the base of the cranium and a little bit of your eye orbits. What I do want you to know here, there's one thing. The sella turcica is part of your sphenoid bone. So if on my skull, the sphenoid sits here, and then it's also the base, the bottom. So there's this little opening, it's not an opening, a little crevice. So right here, the sella turcica is a little crevice that holds your pituitary gland, which is your master gland, very important. So the sphenoid bone has the sella turcica that holds your pituitary gland. Ethmoid is right in front of the sphenoid. Here, some of your nasal concha are located there, but I probably won't have that located anywhere. Your face has 13 immovable bones and 1 that moves. So the movable lower jawbone is basically what's the only thing that's going to allow you to talk. So the maxilla is the upper jaw, your hard palate, the top part, the roof of your mouth. The bottom of your eyes are your orbits. It forms the sides of your nasal cavity. It holds your upper teeth, and it has the maxillary sinus. So, hard palate, part of your mouth, maxillary sinuses, palatine and alveolar processes, not as important, and alveolar arch. Palatine bones are behind the maxilla. Here again, probably won't have you label these. Zygomatic, yes. Zygomatic cheekbones. So your cheekbones are your zygomatic bones. Your zygomatic bone will have your temporal process. So in the formation of your cheek, so if I look at my skull that I have labeled, I have the zygomatic bone is my cheekbone. The temporal bone sits here. They attach right about here. So on my zygomatic bone, this part is called the temporal process. On my temporal bone, this is called the zygomatic process because it tells what it's going to attach to. The zygomatic process on the temporal bone will attach to the zygomatic bone. And that's going to form then this whole part here is the zygomatic arch. Lacrimal bones form part of the middle of your eyes, and then the nasal bone is just the bridge of your nose, the hard part or top part of your nose. Vomer bone is going to be inside of your nose. It makes up the septum, or the part that divides your nose, and we'll look at a diagram. Inferior nasal conch. Anything that's conch or conchae are going to have a rolly, squiggly appearance to them. And then here, number 8 is your only movable bone. So when you think about talking, so if you pay attention at all, your mandible does not move at all. The only thing that's moving when I'm talking, or yawning, or chewing, or whatever, is your mandible. So your lower jawbone is the only bone that moves. Supports your lower teeth, and then it has a condyle and a process on it that we